Labor and the Coalition have unveiled the bulk of their pitches, with the major parties both committing to $8.5 billion to expand the bulk billing incentives to all Australians. That pledge also includes money to train new GPs and incentivise junior doctors to become GPs. More than $570 million for women's health, including spending to encourage long-term contraceptives, and $690 million for cheaper medicines, bringing the cost of drugs on the PBS down to $25. But there are points of difference. On urgent care clinics, while the major parties are committing to the existing centres, the Coalition stopped short of endorsing the additional 50 promised by Labor. And on mental health, both the major parties are promising about $1 billion, but with different ideas of where it should go. Labor's promising to build and upgrade new mental health centres and train more mental health professionals, while the Coalition is promising more Medicare-funded psychology sessions and expanded youth-specific services. To discuss this further, political reporter Stephanie Dalzell joins us now from Canberra. Hi there, Steph. A lot to talk through there and a lot to digest. Can you take us through the main pledges from both parties?
Certainly. So the centrepiece of Labor's healthcare re-election pitch is that promise to make 9 out of 10 GP visits free for patients by the end of the decade. This is part of an $8.5 billion over 4-year commitment, and Labor says it's the biggest investment in Medicare since its inception. The Coalition has swiftly matched this commitment dollar for dollar. It sees little to gain in a fight about healthcare, and it's been keen to try to neutralise attacks on healthcare by matching these major commitments. Now, it's worth noting when we talk about bulk billing rates that, of course, doctors have raised concerns about whether this target is realistic. And in fact, even opposition leader Peter Dutton has said that doctors have a right to be sceptical about whether that move to get to 90% of the bulk billing rate is possible. Labor insists that it is. And it's worth noting when we're talking about bulk billing rates that we're talking about visits and not people. So this doesn't mean that 90% of people will be able to see their GP for free. What it does mean is that 90% of visits could be bulk billed by 2030, and that certainly is the target. In terms of those visits, they are inflated or bolstered by children and elderly people who see the GP more and therefore are more likely to be bulk billed. And when we break down rates, when we look at health department figures, for example, from the 23-24 financial year, less than half of Australians were always bulk billed when they saw their GP. So that's worth keeping in mind. In terms of other pledges, we've got a $500 million commitment for women's health. It's been long ignored, and the major parties have really made it a focus in this campaign, pledging more money to boost the Medicare rebate for long-term contraceptives. The uptake in Australia is quite low, and this is in acknowledgement of that. And there's also more support for menopause. In terms of other pledges, cheaper medicines are also on the cards, regardless of who wins. Both major parties are promising to bring down the cost of most PBS medicines from just over $31 currently to about $25.
Okay, so Steph, there's quite a large range of similarities that we're noticing from both the major parties here, but there are some stark differences as well. Can you break those down and explain what those are?
There are some differences. One of the key differences is when we look at urgent care clinics. These clinics are dubbed the secret weapon of Labor MPs out on the hustings. They're hugely popular with punters, and Labor MPs have been telling us that it's the thing that they lead off with when they're door knocking. Do you know about that urgent care clinic that's going to be built down the road? Now, the Coalition supports the existing almost 90 urgent care clinics, but it has stopped short of endorsing the additional 50 that Labor is promising to build if it wins the election. Instead, the Coalition is saying it'll look at them on a case-by-case basis. That's left the Coalition exposed. Labor has pounced. It's running hard with a campaign that the existing clinics are under threat under a Dutton government, even though there's no suggestion from the Coalition that those centres are going to go anywhere. It's doubled down on those attacks, even though the Coalition has described them as disgraceful lies. And we're seeing some scare tactics being used by Labor. They were hugely successful in the 2016 Medi-Scare campaign, and reflecting on those, former Prime Minister Malcolm Turnbull said there'd been fertile ground for the grotesque lie to be sown. And we're seeing that fertile ground be used 11 years later. What is he talking about? He's talking about Peter Dutton, the opposition leader, as health minister, overseeing an attempt, a very politically costly attempt back in 2014 to try to introduce a GP $7 co-payment, seen as an attack on the fundamental principle of Medicare universality, and also oversaw cuts to future spending in health in the 2014 budget. We are seeing Labor campaign incredibly hard on that. Today there was a debate between the health leaders, and Mark Butler came armed with receipts. He had the budget in his hand ready to go. So Labor's been really running hard on the fact that health could be under threat under a Dutton government, even though the coalition is strongly denying that, and it's been really forced to play in the defensive this campaign as a result.
Steph, in the minute that we've got left, I mean, all of this speaks to cost of living pressures, which we know both major parties have been campaigning on over the last couple of weeks. But what do these pledges actually mean for voters?
So a lot of voters will notice that it's cheaper to see the doctor or to get medicines, and that'll happen whoever wins because of the bipartisanship of these policies. In terms of other things, we know that people are increasingly skipping care because they can't afford it. People are languishing on wait lists to see specialists. At the moment in parts of the country, people are waiting almost 4 years to see a brain surgeon for an urgent appointment. And these policies, experts have argued, aren't really going to do much to shift that. So the idea that you'll only need your Medicare card when you go to the doctor, as presented by the Prime Minister, is unlikely. It's unlikely that people will still face out-of-pocket costs, and experts have argued that these policies, while they'll help people, they don't do much in terms of reforming the sector.
Steph Dalzell, thank you.